Okay, well, it is my pleasure to welcome you to today's installment of our Public Policy and Philanthropy Speaker Series. The series is designed to explore the dynamic relationship between philanthropic action and public policy, how each can shape the other in pursuit of the public good. Today's conversation will illuminate how philanthropy can respond to urgent needs, influence policy, and build lasting infrastructure for equality and well-being. We hope it will also inspire new thinking about how each of us, whether scholar, student, practitioner, or policymaker, can contribute to a more just and healthy society. So thank you all for being here in person and online, and let's begin. Walter Panzirer is a trustee of the Helmsley Charitable Trust, one of the largest private philanthropies involved in global grant making. There he oversees investments in rural healthcare in the US and select high-impact work across sub-Saharan Africa. Walter is committed to helping people live better lives today, no matter where they call home. Before being appointed as a trustee more than 15 years ago, Walter served as a paramedic, firefighter, and police officer in California and South Dakota. In those roles, he witnessed the significant disparities in the quality of healthcare available close to home. As a trustee, he's dedicated to changing that. He has a deep interest in supporting innovative programs and technologies that help build resilience in communities, ranging from novel healthcare solutions for rural areas in the United States to reducing plastic pollution in the ocean, and so much in between. His curiosity, coupled with a get-it-done acumen, means that he's always looking for leapfrog opportunities that can be readily implemented to help improve and save lives. I would also like, in addition to thanking him for being with us, coming all the way from Hawaii, I would like to thank our senior fellow, Diane Kaplan, for her tremendous help throughout this series. She is the longtime CEO, former CEO of Alaska's largest foundation, the Rasmussen Foundation. So we picked the farthest places people could, Alaska and Hawaii. We're so grateful to have Diane with us today as we dive deeper into an engaging and thought-provoking discussion on how philanthropy impacts public policy. At the end of Diane's lead questions, we will have time for audience questions as well, both in person and Zoom. So please feel free to jot down your thoughts. I will make sure there's time for you to ask and engage with both Walter and Diane. Thank you both for being here, and I pass it on to Diane to begin our discussion.
Thank you, Amir, and welcome, Walter.
Thank you.
Yeah, this discussion has been a long time in the offing, and we are really grateful to have you here in Indianapolis. First of all, the creation story for the Helmsley Trust is very unusual in foundation land, different from most. And I wonder if you'd give us some context on how the trust came to be.
Sure. The trust, it is a very unusual story because I was unaware this was even in play. Full disclosure, Leona Helmsley was my grandmother, and I never knew what, I always had a great relationship with Mrs. Helmsley, Mr. Helmsley. We were super close throughout my whole life, but I never wanted to work for her. She always came and asked me, come work for me in the hotels and everything else. But I was too much of a free spirit, and I like my family, and she was a very tenacious boss, and I knew wouldn't buy it well. So I did my own thing, and I never asked her for anything. She did her thing in her real estate empire, and never knew what she was going to do with her money. It was her business, none of my business, and none of the other trustees' businesses too. And I didn't know what she was going to do with it until a few days after her death, when I got a phone call from a lawyer saying, "Mr. Panzirer, you're been assigned as a trustee to a charitable trust created by her grandmother." And I thought, wow, this is amazing. What does this mean? And we met in New York with the other trustees that were selected. And none of us really knew that this was going to happen. So, and what was even cool, so cool, that she hand-selected everyone. Myself, my brother David, my uncle Alvin, 2 business associates as well. And in the trust documents were blank. She said there was full discretion to be done of what do good, the exact words were, do whatever good what you choose at your discretion. There were no guidelines. So that's super duper unusual when you look at that. Usually, anytime throughout history, when a trust has been created, it says thou shalt do this or be involved in this. This was a blank sheet just to do good for mankind. And what an opportunity. And so we all looked at giving patterns of life of my grandmother. And she gave a lot of money to healthcare, tons of money to healthcare throughout her years of living. All over from hospitals to diabetes research to colitis research, things like that. And so that's how we started looking, and then we formed programs off that. Do you want me to get into a little bit of programs?
Yes.
And so we all brought ideas of some programming. So I looked at, being my grandmother was very interested in healthcare, and I saw healthcare disparities, huge healthcare disparities.
Give us an example.
Okay, I'll give you a real example. I grew up in California, in the Bay Area of California. Healthcare was very good there. I worked as an EMT and then a paramedic in the Bay Area, in Oakland, California, and San Leandro, California. Very rough area. I worked to put myself through college as a firefighter, seasonal firefighter with the Forest Service, saw rural areas, how things were done, rural EMS in California, still pretty good. It wasn't until I hit my burnout career phase as a paramedic that I ended up on a fluke moving to South Dakota. And I was working as a paramedic and then law enforcement over there. And I saw how different the care was in the rural Midwest, how challenging. It wasn't that there were bad physicians. It wasn't that there were bad nurses or anything like that. It was the lack of opportunity. It was the lack of technology over there. So that's when I thought, okay, who else is doing this type of healthcare, focusing in the rural areas? Because I see huge disparities of care. And we did some research. We hired Rockefeller Philanthropy advisors to research my idea. They researched the idea and saw that there was truly a gap. They actually did a quick white paper for us, a study paper on it that said 2.5% of all private philanthropy went to the upper Midwest. 2.5%. That's very little. That's the donut hole. Because I figured rural healthcare, I'd go anywhere. You know, I naturally made the assumption that the worst of the worst was going to be in West Virginia or the Deep South, because that's what everybody hears. But 2.5% of private philanthropy went to the upper Midwest. And the crazy thing is, we drove down, or they dug down even deeper. They said that 80% went to Minnesota. Why Minnesota? Anybody have an idea?
Mayo Clinic.
Got it, Mayo Clinic. And Mayo is a wonderful, wonderful institution, but until recently, if you had a problem, you went to Mayo. Mayo didn't come to you, but there's still a massive donut hole. So that's where we set up operations in the first 5 upper Midwestern states. And over the last 15, 16, 17 years, we've grown our footprint now to 9 US states and 2 US Pacific territories, 2 for our rural health.
So when you got that call,
Mm-hmm.
did you know what the size of the trust would be?
No, I didn't. It wasn't until it was disclosed that pretty much 99% of her wealth was going into this charitable trust. And that was just so shocking for me and everybody else, because this woman, my grandmother, was so charitable. Really, despite her prickly pear persona, she was so charitable even in life, because when we dove down and saw where she was giving to, she gave a lot of things anonymously. And I remember as a teenager, my grandmother signing checks to different charities and things like that. And she actually said something that kind of resonated, saying, as she was signing the checks and telling her accounts to give to this, give to that, was, don't let them know I'm doing it. And after the accountant left the room, I said, why? You know, as a teenager. And she said, well, I don't want people to think I'm weak. She saw, because you got to remember, she was a woman in the 1970s, super successful, and in the early 80s. And women never achieved what she achieved back then. It was truly a man's world, and she broke through that ceiling. And she was a ruthless business person. That's very, very true. She was a strong personality. And she saw that, she told me that she didn't want people to think that she was weak. But by giving money, they would think that was a weakness. I think that's a flawed way of thinking on it, but I understand why she thought like that. So she did a lot of it anonymous, like millions and millions of dollars to her, millions of dollars to building hospitals, and doing different things all over the South. Where till I knew about it, you know.
So when you were growing up, did you touch philanthropy in any way in your family as a kid? Were you involved in anything nonprofit like that? Or, I mean, the jobs you had clearly were service oriented. So talk about that a little.
Sure, I grew up, you know, very humbly. You know, my grandmother was like a superstar, everybody, you know, big deal, a very big deal. I grew up on the other end of the spectrum. I grew up in California, after my father died with my mother. And we grew up very average. I went to public school for most of my life till high school. I went to a private Christian school. And that's what really forced started my view on philanthropy, because the school required that everybody did so many hours of community service into the community. I worked at the VA hospital and whatnot, and the school allowed me to go into community college and to get my EMT course with us in school. And it was very much service pounded into my head, in a good way, from the high school I went. And then after that, as you noted, everything has been service. I worked as a paramedic, I worked as a firefighter. I've worked in law enforcement for 9 years. Even after law enforcement, I was studying to be a pastor through the Nazarene Church. And actually, I was 3 classes from ordination when my grandmother died and placed me in this role. So when you're really talking about where I'm sitting today, every step in my life has I totally believe in divine providence, had a hand into it. You know, I would never understand why doors would close and opportunities would go away, but it was for a reason. It was to better hone me in, better to train me. I actually did work after my law enforcement career. I got a job that I was grossly underqualified for. So here's something for everybody studying, every student, especially the younger generations. Don't be afraid to apply for a job that you don't think you're qualified. I did. I applied for, straight out of law enforcement, I applied for a job as a program director for a not-for-profit. That was a multi-state not-for-profit teaching sexual education in high schools in Wyoming. Only reason I think I got the job was because I was a school resource officer for part of my career, an investigator, ran for sheriff. So I kind of knew how to talk. And also when I was early into law enforcement officer, as a law enforcement officer, my chief of police in Sturgis said, "You're a college kid, take a crack at writing a grant." And I wrote, with the help of the school district, a grant my first time out for a federal grant for putting police officers in school. Got awarded a $250,000 grant. I had no clue what I was doing. You know, so something resonated with the
Demonstrated your value.
Yeah, and I got a full-time job out of it. You know, pretty much the chief of police said you got a full-time job. But where I was going with that is everything has led me to where I am today. From grant reporting on being a program director, having a staff. I never knew where I was going to end up. That's just kind of a cork kind of just floating with life.
Let's go back to the trust for a second. often you see, not always, but often, a business person who during their life was incredibly controlling and direct and in charge. And yet, when it comes to their philanthropy, they pretty much leave it all to chance. It doesn't make any sense, does it?
I'm really surprised, knowing how controlling my grandmother was in life, that I'm floored, but I'm also humbled thinking the people that she selected around her, my other co-trustees, were all very special people in her life that I think she trusted. I know she trusted deeply, otherwise she wouldn't be trustees.
And that's why she was willing to do that.
I think so. I think I really do, but that one really surprised me because knowing my grandmother like I knew my grandmother, I would have not. She surprised me in a lot of ways. I didn't know she was even doing this trust. No.
And it's an interesting phenomenon when a family creates a philanthropy. It's not always your kids or grandkids who you imagine might want to follow exactly the kind of things you do. I mean, you could think of your own kids, or are they interested in the same things you are? But your buddies, your colleagues, your professional affiliates often are of similar mind. So you often see non-family members on a board like your trust.
And we do have
Especially,
non-family members on it, and it's a healthy mix to have non-family members and family members there because everybody's bringing different perspectives. The non-family members were longtime business associates of my grandparents and truly understood them from the business and landscape of it. Where family, a little different. You see the more of the personal side. And so having that dynamic is, in my mind, very valuable. I would hope more donors or whomever is starting up charitable trusts and foundations would have that lens to look into, because I think both the professional and the family bring so much value together when they're combined.
A lot of private philanthropy stays away from working with government for various reasons. Either they think it's inappropriate, they think you shouldn't do it, they think you might violate some rules, it kind of looks like lobbying, whatever it might be. And yet some foundations, yours being clearly one of them, and one of the reasons we really want to have you here, lean in to tackle big issues. Now, when you look at your background, having worked in government, I wonder, was that a leading reason why when you became a trustee, you saw that opportunity to get things done, you partnering with local, state, tribal, federal government?
First, let me preface one thing. Within being a private foundation, we are not allowed to lobby, full stop. We cannot, and we're prohibited from doing direct lobbying to anything. But with that, it is so important when you're developing partnerships to get everybody on the same page, or at least on the same sheet of music. You can't make a change without involving all the stakeholders. And whether we talk about our global, I'll talk about it in two ways. We'll start with our rural health, and then I'll talk about our global aspect of it. Our rural health program, we work with tribal entities, we work with state, we work with county and federal, but we all dialogue together because you have to have an open dialogue if you want to make a change. You have to get everybody on the same page. It's not lobbying. I'm talking about educating people of the problem. I'm not telling a senator to go vote this way, because you clearly can't say, Senator, go vote this way, or Congressman, vote this way, but because that's wrong and improper. But you have to have a dialogue with all the policymakers. So what we've done in the rural healthcare aspect of it, we have worked with both RUPRI, which is the Rural Policymakers group, and have granted to the Bipartisan Policy Association as well for some of our telemedicine and telehealth stuff, where we're not funding lobbying, we funded the policy education piece. So we helped develop, we didn't develop, the experts developed, we wrote the check the policy piece is the education piece. It's not saying that, not taking it to the legislators, but just defining what the problem is. Like, for example, Rupert leans into telemedicine, and so does Bipartisan Association on Telemedicine Reimbursement, the challenges and what's needed to be done to make it successful telemedicine. We don't lobby, we just help provide the education pieces. Somebody else ran the lobby. When it comes to our global portfolio, when we're talking our work with in Africa, we should preface we work in sub-Saharan vulnerable children, both in Ghana, Burkina Faso, Zambia, and Ethiopia. That's even more important, and it's all mostly health focused. It's even more important to have everybody have a say in that. When I say everybody, it's much more complex. It's not just their federal government or the health department or anything like that. You have to have tribal buy-in over there, because tribal lines run deeper than geography lines. So it's making sure that the chiefs are involved, making sure there's listening sessions for the chiefs and community stakeholders, making sure that the ministries of health are involved in what we do. And you have to have all those people together if you want to have truly sustainable programs. I should have prefaced by saying everything we do at Helmsley Charitable Trust, we want it to be sustainable after the grant. Because in my mind, if we introduce something to a community, whether it's an oxygen plant in Ethiopia, making medical grade oxygen for the hospitals, or if it's a cancer center in rural America, those things have to be running years and years after the grant. I never want to introduce a service line to a community or something to a community in Africa, whether it's an oxygen plant or a neurosurgery center or fill in the blank, and have it gone right after the grant, because you're doing more harm to the community than not doing it at all, because you're introducing something that everybody's become accustomed to. They want to get cancer care in the community. And if that service line closes, you've done way more harm than what we've done.
Dean Pasic,
I'm just wondering, are there conditions under which you've seen these kind of dialogues succeed, and then conditions when this kind of dialogue that tries to be inclusive don't really, take off the way you want?
Yeah, there's always a challenge. Sometimes even when I really think they're going to succeed, you get into bureaucracy and things move even slower and slower. But to make it a biggest chance of success, it's real important before you have your first call or your first meeting to figure out who your stakeholders are. Because you want to get that right before you even show up. Because you want to make sure all your stakeholders are invited to that meeting and participate in the meeting. Because it can be a huge slight if you accidentally leave someone out. So we are very purposeful within our departments of making sure that everybody is represented, where like in rural healthcare, that we have county people. If it's a county problem, we have tribal people involved, we have state Department of Health involved, because you can't leave people out, because especially on a first meeting, that can totally sink your ship.
So have you ever had a situation like that you could tell us about, where things were not working out the way and you had to pivot and you were able to do that successfully?
Yeah, I can think of a way. Way back early on, we had the virtual crisis care program in South Dakota. I'll give you a quick 10 seconds on what that is. But that's a behavioral health program for people who are in crisis, to be able to access a behavioral health care team. And it's usually when you call 911 and you have suicidal ideations, the police officers show up. And so the police officers have this tablet where it's connected to a behavioral health care team. They get the individual in a safe area, they give them the tablet, and experts talk to them, and they determine whether they're a threat to themselves, it determines safety plans, etc. And what we've seen, I'll just say the success part of it, what we've seen with using that plan is we've reduced transportation to distant behavioral health care facilities 80% of the time, and 50% less recall rates back for the same individual. So it's making change. But this was something brand new and something so organic. We started out, this came out from just an accidental meeting that I had with South Dakota's former Chief Justice of the Supreme Court, Chief Justice Gilbertson, who was a champion on judicial reform in South Dakota. And we started talking about how life was when I was in law enforcement, the challenges with behavioral health calls and the challenges to try to streamline it, taking an officer out of service for 10 hours and yada, yada, yada. And so then we were doing a lot of work in telehealth. I brought our telehealth people, Avera Health, to the table, to dialogue with Chief Justice Gilbertson, and we started bringing more stakeholders. Initially, we did not bring all the sheriffs to the table. We pivoted, we brought the sheriffs to the table because they were some of the most skeptical people, because they were like, you want us to use this? Who's gonna pay for it? How's this gonna look? Is this, as a former law enforcement officer, I totally get where they were coming from, because they're going like, oh, you want to give us another tool we have to carry around and be responsible for and check out, and it can be more challenging than others were. But we had to pivot and get early wins on the system, because I initially wanted to do it all across the state, a one shot, because to me, go big or go home, you know? And we couldn't get the buy-in to go big. So we had to do a demonstration project where we involved, I think it was like 15 or 20 counties, wrong initially, and get some early champions. And we found those early champions where we used the sheriff from those communities that absolutely love this to tell others. And we grew and grew, covered pretty much the entire state of all the counties in South Dakota. And the cool thing was we expanded to 2 other states because a word of mouth got around. And that's pivoting when you're trying something new. You're pivoting, making sure you have all the stakeholders, because we didn't have all the stakeholders. But it worked really well.
So you might have noticed that we had a new president of the United States in 2025. And that has affected many different areas on federal policy in a rather short time. Many of those are areas where you work, whether it's in healthcare, the national parks, for example, in the US. Talk about how has the Helmsley Trust and how have you personally been affected by some of the changes, and what's your response around that?
Well, I gotta say, anytime there's a policy change, regardless of the president, which president's in the office, it's going to cause challenges for everybody involved. And this is where philanthropy becomes even more important, because whenever there's budget cuts, just like the USAID budget, even with all the philanthropies in the world, or in the United States coming together, we couldn't fix the USAID cuts. But it makes philanthropy become sharper. We have to be better at grant making. That changes what success is. For example, it used to be in our portfolio for vulnerable children, what is sustainability? Well, sustainability means community adoption and somebody else paying for it after the grant, which is usually USAID. That's over, guys and ladies. That's probably, even if we had a new policies in, things have changed. It's going to take years and years and years to get back to that, if people can choose to get back to that. So, but this is where it becomes even more important for every program officer, every program associate, everybody in philanthropy to really sharpen their pencils and say, what is sustainability? Because it's no longer the government, USAID paying for it. Now fast forward to today, what we look at sustainability is community buy-in. Even more so. When I say community buy-in, I mean physical money coming from the community buy-in. I'll give you an example of a success we've had. In Ethiopia, we've partnered with Clinton Global Health Initiatives and have and worked with them to produce oxygen plants for hospitals and a distribution system so that every hospital across Ethiopia will have oxygen. Now that's huge because coming from the United States, people think, well, it's a hospital, it has oxygen. No, most of the developing countries, that's a challenge. That's a game-changing challenge. So how did we do that? Well, we worked with the Ministry of Health, and Clinton Global Health worked with the Ministry of Health to lay down their groundwork. We had physical buy-in from them. Okay, they were training biomedical engineers to maintain the plant. They also had an agreement for parts. And what we did differently than, when I say we, all the funders and with global health, we did differently where everything was the same. So it didn't matter if you were in McKellar or Arbor Minch or Addis, the plant was the same materials. So that way you have redundancy and everybody knew how to do their things. So with that, you know, that success, it set up the government for success to continue to maintain that. And we have sureties that the government will maintain that. We also did this earlier on in Ghana. What does success look like too? Is it government adoption? We worked with Catholic Relief Services up in northern Ghana to put in, basically it's an ambulance, but it's a motorcycle, tricycle for women and children, to get women to skilled birthing facilities and stop home deliveries and whatnot. It took 6 years of work, but it got really, really popular and highly adopted. Before it was our name on it and CRS's name, saying it's a CRS little amulet. And then the Ghanaian Ministry of Health saw such value and saw what was being done up in the very north from our grant making and expanded it across the rural parts of Ghana. So now it says Ghanaian Health Services, and now it's a standard of care all across rural Ghana. So that's what sustainability is. That's what I mean by having a government adopt whatever you are doing in philanthropy. And we got to think a mindset of that now because it's changed. And now if we're talking rural healthcare, let me pivot back to the United States on policy and stuff like that. It makes us even more important because hospitals are on razor thin margins. These critical access hospitals, a lot of them don't even have 30 days of cash on hand. That's what we're talking, that's how thin some of these hospitals' margins are.
Explain what you mean by a critical access hospital.
A critical access hospital is a federal designation where it has to be, I want to say like 40, 50 miles or better from any other hospital. They can't have more than 40 beds. Usually they're really small hospitals, you know, your 10 bedders and 2 bedders, your safety net hospitals in rural areas. And whenever there's a funding cut, these smaller hospitals feel it, whether it's a Medicaid cut because you don't have more uninsured charitable care that they're not ready for because their margins are so thin, to whether it's, you know, even let's look at if you don't have insurance, you're not going to primary care, right? So you're going to be presenting even more sick these rural hospitals. And we already know through studies that rural Americans have more advanced diseases, they present sicker to the hospitals. And so now we're going to exacerbate the situation, funding cuts. But we're not here to change whatever's done. We're here, we live with whatever the policy is, but this is what's so important to, in my mind, to help the critical access hospitals develop new service lines to sustain the service lines. For example, we placed cancer centers, I can't remember how many, but far north of 10, 12 cancer centers all over the upper Midwest and in our 9-state service area. And we are partners with the hospitals. We don't write checks. I want to say we are partners through and through. Doesn't mean we're a cost share on the upside or anything like that. But we help my team, when I say we, it's all my team, helps with the hospital to develop plans to make sure that that is sustainable. And every one of those cancer centers either break even or make significant dollars where they can help support the hospital in other areas. So it's looking outside the box that way to really make things sustainable and to really take a business mindset to it, not just a charitable mindset, because we're all here to help people. But if you can make that sustainable, whatever you invest in goes so much farther, even into the next generation.
Well, let me just reverse that, because we do some research on kind of the conditions for doing global philanthropy in different countries, trying to help policymakers understand when philanthropy can help that, because sometimes policymakers or leaders of government are skeptical about this thing called philanthropy because it's not something that the people who are not in philanthropy know that much about. What do you tell policymakers who may be skeptical about, what role you play in the ecosystem? How do you get them on your side, or what do you look for in terms of good policy partners who they're going to get it as opposed to being obstacles?
Well, we try to reverse anybody who's trying to be an obstacle by educating them. It's so important to say, what are you doing? What are you bringing to the table? Why are we doing this? And we can show from our low-hanging fruits that whether we can improve outcomes, like going back to the cancer example, that we can lower the stages of cancer detection. We can keep people in the community healing, because it's really sad when you're talking in rural America that sometimes women, and this is what's heartbreaking to me, I've heard this time and over and over again, that women will opt for radical mastectomies instead of a lumpectomy with radiation treatment because they can't afford to go to the big city. They can't leave their farm. They can't leave their community. And it's by telling those stories that really affect the constituents. This is the policymaker. If they have a case of somebody who has gone through the struggle or related, more human that they've gone through the struggle, of whether it's cancer, cardiac, trauma, you can fill in the stroke even, and how it affects the community, you can get the policymakers on your side. When we're talking rural America, it's real easy to get the policymakers on your side. When you talk economics, you just got to know who you're talking to. If you're in a room full of bankers, you don't speak bankerese. If you're with lawyers, you don't bring a lawyer to speak lawyerese to get them on your side. But when you look at the economics of improving rural healthcare, whether it's in Africa or in America, there's studies that go around, and this is why it's so important on policy work to fund studies, to fund groups like Rupri, who does the studies, who gets the data. That's so important, because you can show that Rupri has shown this, that every dollar that's spent in the local community goes around anywhere between 5 and 8 times over in that local community. So by someone getting their mammogram in the small critical access hospital, or getting their labs, or that have the newest access to x-rays and CT scans, get their CT scans there, that dollar's being spent over and over in that community. And it's further underscored through studies that if you have a healthy hospital, that's key to having a healthy community. It's one aspect of it. When I say healthy, I don't mean physically healthy, that's common sense. I mean like economically healthy, because usually the hospital outside of the schools are the largest job employers. They have all sorts of ancillary services that come because of the hospital. It ends up being a huge economic generator. And policy people get that, government people get that, because they're all in it to help their constituents and to help their people that are in the community. But if you bring it to that, they understand it. And that's why I said it's important to get everybody in the room, whether it's the county, the Department of Health, the state, because they all want to help the people. And if you have them early on in the dialogue, they don't tend to be obstructionists usually. You always get some bad individuals that can be like that, but most bureaucrats and most people want to do what's right. And it's just all about educating.
Did you have examples of, these kinds of dialogues and efforts that you weren't able to succeed and that ended up being frustrated and you walked away?
I'm stubborn. I get that from my grandmother. I'm super stubborn. I don't walk away too often. Let's just put it this way. I've had cancer centers where we have been in dialogue for like 8-9 years to get a cancer center or a cath lab put in. And it's taken 8-9 years to demonstrate the case. They eventually do it. And they're still operational and doing that. But, there's places where I'll be honest, where we have walked away from because it's been so difficult in our African portfolio. But some of that has been because we used to be in Kenya and we used to be in Angola as well. Kenya, we left Kenya mostly because they decentralized their central government and things got a lot better there. So they fixed their own problem. Angola was just a very difficult place to look work, where there weren't a lot of NGOs, there weren't a lot of it was challenging with corruption. It was challenging with how the government was set up. So it took, we were doing work with neglected tropical diseases over there. And it took like 6 years to get a national plan. Jeez, it's too long. And we stayed in it for them to get a national plan because we figured, okay, that's a safe place to exit. But we're also seeing it right now in one of our countries as well that's challenging to work in. And it's totally out of the government's control. Burkina Faso has been facing huge problems with insurgencies and they've always had a revolving door on governments, but even more so over there where we've had projects all over the country, but our area of influence is now only like 1.5 hours out of the capital because of all the security issues over there. But that's out of policy of control. That's almost a pseudo civil war.
So I was just going to ask you also, back to the United States, and Diane brought up the fact that we've had an administration that has some pretty strong ideas about philanthropy in the nonprofit sector. Some of those tax changes have been enacted through the Big Beautiful Bill, but there are also broader conversations about the role of foundations, the role of philanthropy, the role of nonprofits that are asking some fundamental questions that haven't been really on the table for about 7 years. So looking at the positive possibilities of that, given that you've been in the mix for some time now, are there thoughts you have in terms of how we could better regulate our philanthropic sector? Are there reforms that you would suggest that would improve what philanthropy brings to the table and improving our society?
I think philanthropy should be very transparent. I think that will help huge. If we are transparent, we shouldn't be hiding anything. And I'm not saying philanthropy is hiding anything, but we need to be extremely transparent because there's policy changes that could affect all of us. This is also a time where philanthropy should be speaking with each other a lot more, just in general, because I'm a firm believer that philanthropy, unfortunately, operates in silos, that there isn't a lot of cross-pollination, there isn't a lot of coming together. And when we can all come together on things, I'm not talking policy now, but I'm just saying moving the needle of whatever problem we want to solve. We are more powerful as a voice. We can make change as a voice when it comes to solving problems, global problems. But, this is stuff where we're in a very uncharted waters when it comes to potential regulations. I don't worry about the regulations because things come and go all the time. Under this administration, one day they say one thing, next day it's the opposite. So, you know, I think it's more important for all of us just to be aware of it, of what's being said, but keep on keeping on doing what we're supposed to be doing because it is so important now, no matter what your philanthropy's mission is, to continue the mission and best support your grantees. Because your grantees need you now more than ever, especially with all the budget cuts and with all the cuts going over there. But going back originally also to say, I think it's important for philanthropies to network, whether it's the Council on Foundations or other convening bodies, just to be aware of what are the potential changes, but not to be hung up on it, you know, because those are gonna come and go.
Talking about USAID, if we have changes in government, in the Senate, the House, the political environment, would your position be, as a philanthropy that has worked extensively, you'd like to see it reinstituted, or would there be something else to take its place?
I think this is my opinion, Walter Panzirer's opinion. Full disclosure on this one. I think there needs to be some sort of hybrid because all seriousness, you can't, giving that much money, there could be some waste, there could be some issues on things like that. I'm not one to say how much money the government should be involved in giving, but I think it's something where, you know, it's been around forever. It's been so impactful for US relations to be helping out countries, helping out allies, helping out, giving goodwill on it. So it's good. I'll be surprised if it's gone forever. I'm sure we'll see something different in the future. I don't know if it'll ever be to the scale of what it is. And I really don't have an opinion whether it should be where it is or something lesser. I'll do the political tiptoe around it, but I can see pros and cons to both sides. And to be totally transparent, you know, that's the hands that we were given. And that's why I go back to my original statement saying we have to do better as philanthropists to make sure whatever we do is sustainable. Whatever we do actually can have long-lasting effects and not just be a flash in the pan, 3-year grant, 4-year grant, whatever, and be a one and done. So it's really building something that lasts for a long time. So what does that mean for philanthropy? It means potentially you could be solving a problem longer. It'll take longer to get to sustainability, but we need to know that going in.
For very rural communities that don't have private corporations, that don't have big philanthropies, that don't have a lot of people who are wealthy, what's the sustainability game for a community like that?
Let me back it up a little bit on that one, because this is also something I learned at the Aspen Institute this last year, which I thought was very interesting. When we compare urban to rural, okay, the rural population is 20%, right? I think we can probably agree around 18-20%. When you look at giving money from foundations and private philanthropies and all the gamuts on that, rural is like 3.5-4%. So let's be really real. Philanthropy is ignoring rural, and they're not getting their fair share. They're getting totally less than the fair share, because if it's 20% and they're only getting 4%, we're shorting them 16%.
So this hasn't changed.
No, this hasn't changed.
So what do you think can be the change agent?
But I think the change agents on it, I'm an advocate for everything rural, not just rural health, but I see shortages on education, shortages on environmental issues and everything else where the rural isn't getting their fair share. But I think if we're talking about equity, whether it's equity in healthcare or equity in philanthropy, philanthropy is overwhelmingly ignoring their rural constituents. the numbers speak for itself. But going back to your question on what can the rules do if they don't have money? Believe it or not, there is money on the rules. You look at some of the community foundations are fastest growing foundations. Community foundations have a huge part to play. And now we're seeing the largest transfer of wealth in United States history is going on from different generations coming down. And this is where community foundations have a role to play and continue to play. So, I've heard great things like the Nebraska Community Foundation have said, treat your community like one of your kids. Make sure you leave something in for one of your kids. And they've had great success raising more and more money across Nebraska. So really, rural can take care of a lot of things rural. There's money out there. It's not all poverty. It's challenging over there, but also this goes back to rural solutions as well. They know what they need. This is why the Helmsley Charitable Trust, I was so insistent on making sure we have an office at that time we decided it was in Sioux Falls, South Dakota, and hire people from the community, hire people that understand rural, understand the challenges. And I don't mean any disrespect to anybody in urban centers, because I've lived in urban areas, I've lived in rural areas, I've seen the difference. But rural solutions need to come from rural people. You can't just put an urban band-aid on it. And rural areas can be incubators as well to making a solution as well. We've seen how telemedicine works in rural areas. There's no reason why telemedicine can't be higher utilized in urban areas because they have shortages as well.
Well, maybe on that note, we might turn to the audience, because I know at least one member in the audience who has something to do with the Rural Philanthropy Institute that is trying to address some of the rural philanthropy desert, if you will. Questions online, in person? No questions online. Christopher.
Okay, I have two comments and one question. I'll be really fast. First, I love knowing your backstory because I've always wondered about the Helmsley glamorous New York City commitment to rural America where I grew up. So thank you for that. It's amazing. Secondly, I loved your grandmother, her attention to detail, her work ethic. It was just unbelievable. So you're lucky. And the question is, a number of years ago, I was part of a family foundation, and the two grandsons didn't have children of their own. And so they decided to spend down the $2 billion corpus and run a business. It had existed for about 80 years. Would Helmsley ever consider something like that?
Actually, that's the one thing that's in our trust documents that we are supposed to live into perpetuity.
Okay.
That was the one thing my grandparents were very insistent on.
Yeah.
As tempting as it is to spend down and actually really supersize and tackle a problem, that would go against my grandparents' wishes. We cannot do that. We will not.
And would that be your choice?
I think it's important to go into perpetuity because let's be really real. If you do it right, your investments can go up multiple folds, and then all of a sudden you can be more impactful. We started out as a $3 billion foundation. We grew selling assets to like a $5.5 billion foundation. And now we're teetering around the $8 billion foundation because of our investments, meaning my investment team's investments. And with that, your annual budget goes up. But doing a mass spend down can be very challenging. I just want to address that one point on that as well. Anytime you go up quickly in value or quickly have to spend down in value, it's hard to give money away well. When I say well, anybody can write a check, but to really do a service, it has to be very thoughtful and if depending on where it is, sometimes it's impossible to spend that kind of money in one location or one area because there isn't enough capacity to absorb it.
Yes.
Hi, I'm really curious. Thank you for sharing also your backstory and about your grandmother asking you multiple times to join her business and you saying thanks, but no thanks.
She got her way at that.
She did, yes. That's what I'm asking, because it seems like, if you were getting ready to finish a degree, and I'm curious, you know, kind of how that was for you, and how, and you seem to love what you do now, and that's wonderful, you know, so that's probably a gift that she gave you.
It is, it's the greatest gift
Yeah.
that she gave me, was really that. I do love what I do. I do love, and I should have prefaced, we're very non-traditional trustee board. We meet every 2 weeks, either virtually or in person. We do a lot of virtually. We have a rolling grant schedule, so a calendar year of grants. So it's not like all the grants have to be out twice. So we're very tailored to what's best for our grantee. And we generally do not take unsolicited grants. And so it's very much hands-on when it comes to our grant teams, working with the grantees, our grant program teams, because everything is, for the most part, invitation only. But, you know, we hire a lot of smart people that.
Yes.
Probably won't surprise you coming from me, but I heard you say you left Kenya because they decentralized and fixed their own problems. And hearing you talk so much about how rural communities need to own rural problems, is that kind of your mindset there, that because of decentralization, you think? I just was wondering if you could elaborate more, if you could, that being a.
The global one's different because there was a very strong central government in Kenya. And when they decentralized it, they gave a lot more power and money available to ship to local areas. The United States is a lot different because you have problems with lack of tax collection in rural areas because you have to do so many miles of infrastructure or whatever, you know, and you have a limited tax source. So you can't, so it's a lot of the urban areas helping cover.
Or
the rural.
you're putting in water and sewer in Alaska for
Yeah.
the first time, and there's no utility, you have to create it.
Yeah, that's
Pay for it,
a
right?
perfect example. I forgot about it. You can elaborate on that one better than I
Okay,
can.
we have a student, Julia, go ahead.
We have a question from online. So this is from Wyoming, and they are asking if you can talk a bit more about the strategy that went into finding mental health support in Wyoming. Because I know you've had some really impactful gifts with Laramie Cody.
Yes, well, we have several, I'm going to address it globally, not just to Wyoming. Mental health has always been extremely important. We saw that as the rural areas are very vulnerable. So we've done a variety of things to help foster mental health. I'll speak with one in Montana because it also affects Wyoming because they're a border state. And we partnered with the Billings Clinic in Montana and did a psychiatric residency program because there were such a desperate need for psychiatrists across Montana and across Wyoming. And we did a rural rotation where they would receive training in Wyoming and in Montana. So that's really cool. So, and what we're finding, this is newer than our internal medicine program, but we're finding that they're retaining over 50% of the graduates in rural areas across Montana and Wyoming. So that's huge. So we're hopefully building up psychiatric capacity on the provider side. We are also working with hospitals as well, making things called empath units, which are short stay units for when people are in crisis to help determine what the crisis is. It's an under 24-hour unit, around 24-hour unit, and help with assessments. We have placed empath units in Montana. We have placed empath units all across South Dakota, Minnesota, and different areas as well. We work with the county government. This which we hope to bring to Wyoming eventually, just like we've demonstrated in Sioux Falls and Rapid City with Pivot Point in Rapid City and the link in Sioux Falls, where it's a one-stop shop. If someone is drugged out of their mind or needing detox, they can get detox. It's a county partnership with the hospitals. They also have an empath unit in there, social services, where they help get them on whether insurances or different types of social services needs to try to be more of a one-stop shop so they don't continue showing up in the ERs and showing up in bad places like that, not bad places, inappropriate places, and taxing local ERs. We've also in Wyoming just launched our virtual crisis care, which was modeled after South Dakota and Nevada's. And that's going to be a complete game changer for Wyoming, where that's going to really help keep patients at home, help keep deputies in their own county, not transporting unnecessary patients. The areas where they don't need services, that way they're only taking the patients that need that higher level of care. So it's critically important. We're working also in the mental health across all of our 9 states with the Trevor Project for the LGBTQ plus youth, LGBTQ plus youth have one of the highest rates of suicide attempts and completions. And Trevor has a product that works. And so what we've done with Trevor to really push it across our 9 rural states to help address anomalies. We're currently looking also, we haven't found a solution yet for the veterans community. Veterans are unfortunately killing themselves at a higher rate than other peers, just like the LGBTQ community. And we're actively looking for a solution to help our veterans because, you know, everybody deserves a shot at life. Everybody deserves mental health. And in order to be equitable, you got to look at where the anomalies are and address them.
In the pursuit of happiness.
Maxim, did you have a question?
Yes, I did. Hi, my name is Maxim. I'm a doctoral student minoring in philanthropy, and I'm very new for American philanthropy. So, excuse me for my question. So, when you say that you need to do well, foundations need to do better. But the needs of the field change, especially when the budgets being cut and policies being changed. How did your trust change the grant making procedures for the trustees? For the grants.
For the grants, actually, you know, we sharpened our, put American slang on it, we sharpened our pencils. We made sure we did better front end diligence. I like to think our teams did great front end diligences. But now with how things have changed, like my example with used to be sustainability was get it to USAID. It'll be there forever, you know, that's no longer there. So it's now community has to come from the local global community or the local community, whether it's rural healthcare, that it has to be sustainable. So now you have to put on more of a business mindset hat on to really drive that sustainability and also be in dialogue because there's certain things that aren't sustainable. To be totally blunt, like mental health, it's generally a loss factor. But if you can, and any hospital system will tell you that, they lose money on mental health. But they do mental health because they have to do mental health. Because if you are not, if let's say you have a chronic disease, it could be diabetes, it could be hypertension, fill in the blank. If you do not have your mental health in check, your chronic disease management will be horrible. And then you'll cost the hospitals and assist healthcare systems even more and more. And this is where the insurance industry has come around too. They see the value of mental health. And that's why everybody's insurance plans have mental health, very much better mental health care coverage, because it's an actuary. But where I'm going with it is, that's where the dialogue comes in at the beginning. Whatever you're introducing, whether it's mental health care into a hospital service or something else that might not be a moneymaker, you have to really make the business case of why you need an empath unit. Well, if you gotta put an empath unit, you're taking the strain out of your ER, getting the people in the right place, you're reducing your wait time, you're reducing the most expensive entry point into the hospital. So that way you can reimburse more money and save more money, and it's a better bottom line on the industry. So it's those type of conversations, it's those type of dialogues that the program teams need to do, our program teams are doing is having those frank discussions and making sure we're in the weeds, because, you know, I can say this because I wrote grants before. You can be a real creative grant writer and put in all the buzzwords and kind of, I don't want to say fake your way through it, but get your grant. And so now it's really important for all the grant makers to really understand that, and everybody understands that. That's always how it is. But it's to be very sophisticated and to be understanding the true business model, because if you don't understand the business model, there's so much. I learned this very early on. There is so much need. Philanthropy can't do it all. There is so much need across the world. There isn't enough money in the world to fix whatever the problem is, whether it's healthcare related, environmental related, or whatever. So you really have to do a good job. This is dating myself, going back to my paramedic lives I've had a long time ago, where you have to triage the situation. What can you solve for? What's going to make the biggest difference? And what's not doing, what the problem won't kill you. Fix the problems out, kill you first. Same thing. So that's where philanthropy needs to.
Those seem like really great words of wisdom to close on. I think we could go on for a while. We would love to ask you about, you know, what our students need to do to be able to prepare themselves to potentially work with some of the great stuff that you do as well. But we're out of time, so we're gonna have you come back at some point. And please join me in thanking Walter and Diane. I do want you to join us back here again in this room on October 30th at 5:30 p.m. when we will have our Milton Murray lecture featuring Luciana Bonifacio, who is the head of development for Save the Children. So one more round of applause for our